Welcome to my channel. My name is Lynn and I am 2 months post plastic surgery. For my plastic surgery, it was done on June the 21st and I had a brachioplasty, also known as an arm lift, and a tummy tuck, also known as an abdominoplasty. For my tummy tuck, I also included muscle repair and liposuction to the front part of my stomach. Now that I am a couple of weeks post-op, I probably should have had liposuction to the flanks and also the bra line. However, I didn't know that, and when I asked about getting liposuction to the flanks during one of my surgical visits, my surgeon told me that he was not able to do that, and I'm thinking that maybe it had something to do with because part of my surgery was covered by insurance, so maybe he can only have me under anesthesia for a certain amount of time. But we're going to move forward with our journey here and continue on our exercise routine to kind of help tighten up some areas. So with that being said, before I started kind of this journey, I was reevaluating my weight loss plan. I had ballooned back up to 218 pounds. On my actually surgery day, I weighed 215 pounds. And as of 2 weeks ago, I have went down to 198 pounds. Yay, back in the 100s. I am so glad to be back in that range. I am a vertical sleeve gastrectomy weight loss patient, and with that being said, from that particular journey, my lowest weight from that surgery was 192 pounds. So I'm close to that weight, especially with all of the skin being removed. And I believe my goal weight, because of my height and the way I look, it's going to be about 180. I'm 5'7", and I have to be flat to be 5'7". If I have on a sneaker, I'm 5'9". So just kind of say that for my height and kind of in reference to the way I weigh myself. Now, this particular video for today is going to be all about compression. So I'm going to insert a picture when I originally went back to work. I maybe day 2, me back into the office. I had on this fitted dress and I thought I was looking cute. Look at this picture, and I'm going to kind of show you, yeah, compression is important, and I'm going to kind of show you what I've been using to compress my my weight. Okay, so as you can see, yeah, we got a little punch in the front area, but being that I have some garments here, I'm going to show you what I've been using to compress my stomach area, and then I will show you actually a couple of clips of some items that what I wear in a day type outfits and how, you know, I kind of feel a little bit better now. So this right here is a binder. This is kind of what it looks like, and it has 2 little strips right here, and it kind of wraps around the front. This is like a one size fit all garment, and then on top of this one, it also has like an extended belt here that you kind of wrap around yourself as well. That's one of my binders that I will wear. And then of course I have a couple of fajas. Now in that clip that I just showed you, I was wearing a faja, and I was probably this one because this one is an extra large. I had to go down the size, I realized, for the faja. So now I'm in a large faja. Let me kind of slide back so I can kind of show you what this one looks like a little bit. It claps between the legs, so it's easy to use the restroom, and it has only, the thing with this one that I noticed, it only has one line of hook. It doesn't have like 3 rows, only the one line, and it zips up. So this is the garment that I had on that particular day. But also, when I'm just in the house and I'm not going anywhere, I typically will have on just another binder that I will link below, and it looks like this right here. It has three little bands in the front to clip around. So this is kind of what I wear, like when I'm just in the house and not going anywhere. I will have on a t-shirt and then that binder there. So that's pretty much what I wear for compression as of right now for my stomach. So now let's get into the arms. So this is kind of what my arms look like without any garments on. As you can see, my right arm's a little bit bigger than the left one, and it has a little bigger portion right in here. As you can see, both arms, I'm gonna lift them up so you can see my incision line. Now my incision line, I don't have an extended brachioplasty because my incision line does not go all the way up to my elbow. It only comes, you know, pretty much halfway where I had the hanging additional skin fat at. So these are my scars here, and what I put on my scars is mainly every day. There has not been a day where I have not put on cocoa butter, Mederma, or it's a scar away for my arm incisions. Well, actually, let me take that back. When I initially had surgery and my arms were completely wrapped in these little surgical binders, these are the wraps right here that kind of look like this, and they kind of wrap all around your arm, and they were wrapped up to my arm. They started kind of right here and they went all the way down to my elbow. And so this is initially what I had for my arm compression. I had on these garments, I have two, so I would take one off and put the other one on, and I wore these for the first 3 weeks of surgery. As my surgeon recommended, I did not wake up in a compression sleeve garment. As I done my own research, I said, let me get some compression sleeves because I think they would better fit my arm. My surgeon never once told me to get compression sleeves from day one, so I just want to make that clear. I am going to see my surgeon on September the 16th. That's technically not my 3 months, but it is kind of my 12-week, if you want to say, follow up with him. So I'm going to definitely bring up the little jiggle that I see right here just to make sure my arms are not going to get any bigger. And once I'm able to get into the gym, I can definitely start weight training to make sure they don't get any bigger and kind of go down a little bit more, and are a little bit more toned. So that's going to be for my arms. Let me show you now what some of my compression sleeves look like. So I'm going to put on actually my compression garment for my arms. It is a arm and shirt garment all in one, but I will show you some of the compression sleeves that I wear. This one, most of my garments either will be like a bra and compression arm garment, or it'll look like this. And I'll try to link all of my garments in the description box. So this is kind of what my first garment looks like here. And then I have my second garment that I use in my arms, which is the one that includes the bra inside. And it also has like some shapewear kind of in the back that is supposed to outline your back here. And this is the front. And it just kind of buckles. If I can kind of show you, kind of buckles up like this. And then you have the sleeves that compress your arm. Most of my arm garments, I had to kind of play around with the sizing. Initially, I bought in medium because I was so shocked at how initially small my arms were. But because, you know, I'm not a real small girl, I still have back fat. I didn't get any surgery on my bra line or anything like that, so I had to go up a couple sizes. Now I'm in a size large for these garments, but initially I had to go up to an extra large. And the extra large is kind of like I can easily put on the garments now without any issues for the extra large and both the large. So I'm gonna go ahead and put on my compression for the day, just to kind of see what I normally look like. So this is kind of what one of my normal compression garments will look like. As you can see, it has the compression for the arms and also for the stomach as well. Okay, this is the outfit of today. I don't have great lighting, but I must say I'm feeling myself today. Cause look, completely flat right here. Yes, I mean, if you're thinking about getting a tummy tuck, look at this. But yeah, go ahead and get it. The pain will definitely be worth it. Alrighty. These pants are a size medium. and I can literally fit them. So yes, we're getting these pair. I also have some jeans I'm getting ready to try on, size 8 and a size 6. We'll see. All right, these are the size 8s, but because they are curved, they fit completely fine. And as you can see, when I have to wear them on a belt because turn to the side a bit, I have a little bit of room here. So the size 8 curve fits perfect. I'm gonna get these, and just the reason why, just so you know why I got a size 8 and 6, because I have some other pants that are a size 10 and were literally falling off me the other day. So now, at least I know I'm in an 8 curve for these kind of pants. And I just pull up regular pants, I'm in a medium. So now I'm gonna also try on some other jeans here. These are a 10. Because they're not curved, so we're gonna see how these work as well. It's a size 10 that I can fit. I literally had to suck in just a bit because as you can see, they fit completely. So I'm going to be getting these 3 pairs. There is one thing that I forgot to mention, was that for my compressions, I have been in a compression garment for 23 hours of every day since surgery. I have not been just walking around without any compression on at all. Every day I'm in compression garments. The only time I'm without compression garments is when I'm taking a shower or doing a massage, and that's typically only an hour, but other times I'm in some kind of compression garments. Now, let me tell you what I'm using on my surgical wounds. First thing I use is going to be a scar lightener, either Scar Away or Mederma here. Now, when I see my surgeon next month, I'm going to ask him if he has any type of medicated surgical lightener that I can use, because I feel like this is working, but there is something that I can probably use that's a little bit better. As you can see, I also have bio oil that I use on my stomach, and as you can see, it's just about gone because I use it every day. Now, the Mederma, I was using this one twice a day, like in the morning and then at night. But when I read the instructions, it said to only use once a day. So I've been using it once a day. And when I take my showers in the morning, I will use cocoa butter. So I use my cocoa butter, of course, in the morning and in the night. But I also use the bio oil to massage my stomach, and also the Mederma to help lighten up my scars. So those are the only 3 items that I'm using on my scars currently. And that is going to be it for today's video as far as how I'm doing 2 months post-op. Thank you so much for watching, and I hope you have a great day.